All right, welcome everyone to this webinar today with me and Dr. Christine Schaffner. And we're going to start in just a few minutes here.
Yeah.
There she is.
I'm here. How's it going?
Great. We're just getting underway here. So let's give people a couple minutes to get situated and find their seats, if you will, the virtual seats.
I love
And
that.
sound check and video check as well. So if you will, if for those of you who are in attendance, please use the chat feature. I'm going to go ahead and enable it for everyone. And please, once I enable it, please use the chat to state your name and where you're from. So that way we can, especially if you can hear me and see me, go ahead and use the chat to state your name, where you're from, so I know that you can receive loud and clear. If you have any trouble hearing or seeing or any technical problem, put it in the chat so that we can try our best to help you. Okay. So, all right. So let's just see who is presente. And we have Lori from Texas. Welcome. Lee from New Zealand. Welcome. From Kiwi from New Zealand.
Mhm.
Kate Young says, sounds good. Awesome. Mary from Tennessee. Dee from Oregon. Deanna from Texas. Great. You can hear me. Okay, great. Isabella from Florida. We have a great kind of spread out audience today. Avro from Canada. Good to see you. Kamloops. I know exactly where that's at. I actually been to Kamloops. Uh, all right. Nia from Santa Barbara. Amy from Northern Cal. Great. Thank you, everybody, for joining us. And we're going to just give it another minute or two. Just so you know, this is being recorded. We'll be sending out a recording tomorrow for those who are not able to be with us today. But for those of you in attendance, you are in for a great treat. I'm very excited to have my great friend and colleague, Dr. Christine Schaffner. And we're going to be talking about sleep as a method of detox. I think this is such a great topic, Christine, because everybody thinks detox is all about coffee enema and castor oil pack and taking, supplements, which they do have an effect. But oftentimes, your lifestyle, what you do on a regular basis is probably one of the most powerful things. So I really love this topic of sleep as a method for detox.
Awesome.
And
I'm so grateful to be here, Peter. And I know that you love talking about the brain and you've educated your audience so much about awesome topics. And, I'm excited to share not only the benefits of looking at sleep as detoxification, but I added some immune pearls too, because I know you're so focused on the immune system and wanted to make sure everyone kind of saw all these angles that are happening when we have a good night's sleep.
tell us about it. So what should our audience know about sleep and its function and as it relates to detox?
Yeah, I have a PowerPoint planned if you want me to do that, or we can have a
Sure.
conversation. But I always love slides because I think it can help us focus our energy. And
Sure.
also, I always love to share resources. And for the nerds in the audience, there's papers to cite and to dive deeper, books to read. So just depending where people are at, what their level of insight and inspiration to go deeper. Alrighty, so I am going to be sharing about this intersection that sleep really supports us, not only detoxification, but I decided to add a little bit about how it supports our immune system. And we're going to dive deep into this really topic of sleep that we all need and we all participate, hopefully, every day. So just a few kind of statistics. I'll give these slides to Peter so he can share this with you. And obviously you'll have the recording too. But a few things to highlight here: about 50 to 70 million Americans suffer from sleep disorders. And insomnia is really a risk for other medical conditions as well. It can lead to more pain, more depression, more immune dysfunction, and it also can have a big effect on our mental emotional state as well. I think many of us know that when we don't get a good night's sleep, we don't feel our best. We don't feel like our true essence of who we are, and it's a little harder to get through the day. And unfortunately, if you're listening to this, or if you're struggling with a health condition, sleep is impacted tremendously, by the chronic illnesses that we all treat. There's a lot more research on sleep apnea and how sleep apnea impacts our overall well-being, and of course our sleep. And about 9 to 38% of the population have sleep apnea. And there's this idea of sleep debt. And it's this cumulative effect of not getting enough sleep every day. And so if you're somebody who's just been struggling and it keeps building and building and building, and as Americans, even if you're not struggling with an illness, we tend to really not prioritize sleep, where most of us are very much, loving life and doing all that we can fit into a day, or striving to do that as we're on a healing journey. And so there's short-term effects from brain fog to memory issues to slowed reaction time to long-term effects, which can affect insulin levels. We're going to dive into the effect on the immune system, weight gain, if you've been struggling to lose weight, or if you have a blood sugar issue and you've done everything, but your sleep isn't optimized. This could be impacting everything, and it just can age us. I mean, we are wired to have a good night's sleep every day. Um, Many of you probably already know this, but this is really important, especially when we talk about how sleep is critical to detoxification and our immune system. So we have these different stages of sleep that scientists have understood, and we measure brain waves. We look at different activity that the brain is going through, different centers of the brain that are active or not active during different types of sleep. And so we've kind of summarized it into 4 stages. And so we have non-REM sleep and REM sleep. And what that means is the brain kind of goes into these different altered waves, and we go from light sleep to then this N2 sleep. And really, where I'd like to focus today, where kind of all the action is, are these deeper levels of sleep that we really need to get into these stages of what we call delta wave or slow wave or deep sleep, as well as rapid eye movement. And rapid eye movement is this whole really curious stage of sleep where we're actually paralyzed and we have a lot of activity going on in our body. And it's a time where we're probably dreaming more. While we can dream in many other, stages of sleep, this is the stage of sleep we most often remember or recall our dreams. And we don't just go 1, 2, 3, 4, 1, 2, 3, 4, and go back and forth between stages. We kind of will go maybe 4, 3, 2, 2, 4. There are these different chunks that we have throughout the night. And I don't know if you're out there in the audience and have a sleep tracker that's on airplane mode while you're sleeping, but we're learning more about sleep with more access. I get a lot more feedback about my patient's sleep because of all these wearable devices that we can, again, control the EMF exposure overnight. And we can see where we might have deficits or we're not optimized during the day. Or the night rather, and we can, really get a quantitative read of deep or REM sleep. And so the average person goes through these cycles in an 8-hour period of time, about 4 to 5 times, and we get REM about anywhere from 5 to 30 minutes, depending on your cycle. So just a little overview of what's happening. And then again, we're going to be focusing on delta wave and REM sleep for the purposes of the conversation. So I just wanted to share that, this delta wave sleep is this slow wave sleep. And you can see these different waves. And we have like a lot of talk, especially in the neurofeedback world and the neurological world, about different brain waves and what they mean and what they are a sign of different types of function in the body. And so delta waves are these low frequency, high amplitude waves where, you're really just in this kind of hibernation state. The body tunes the world out and there's not a lot happening in the brain. We're really recovering from at least a rumination and an activity perspective. A lot is happening in our body, and we're rebooting in many ways. I really love some of the pop culture books like Matthew Walker's Why We Sleep. He did a great job, just highlighting some of the key points, and then we'll go deeper with some of the science and clinical anecdotes that I'm sure Peter and I both see. So, why we need deep sleep is it's a really important time for our brain to relax, for our memory to what we call consolidate. So, all the things that are happening in a day, all the things that we're learning, our memory has to actually process and really create neural networks that are going to become a long term memory. Again, it's a time of a lot of glucose metabolism, so it can help us with short and long term memory. It's great for hormonal balance. We actually secrete a lot of growth hormone, which is very healing and repairing of the body. As we age, growth hormone can decline, and that's even more reason to get good sleep to optimize our growth hormone levels. If you ever had a head injury or a traumatic brain injury, you might actually have low growth hormone to begin with, and so sleep is even more critical. Or you want to work with somebody like Peter and myself to optimize and restore good growth hormone levels, because that can actually impair healing. And that's a simple LabCorp test that you can look at growth hormone or insulin growth factor. Many of us, even if we're on a healing journey, we're stressed out all day long. Our vagus nerve needs a lot of support. Peter's done a great job of educating about the impact of the vagus nerve, but we really get in this parasympathetic state when we're in this delta wave sleep. And then we can, again, restore ourselves. Cells are regenerating. We're getting more blood supply to muscles, and we're promoting growth and repair of our tissues and bones. And just another clinical pearl, if you're able to and you're feeling good enough to exercise, exercise is a way to increase your deep sleep at night. Again, this healing state that we, all go through.
Christine, I just want to highlight something.
Yeah, let's go back.
In the last slide, I want to point out something really important that I
Yeah.
really try to make a point to teach people is that glucose, you mentioned glucose metabolism in the brain increases during deep sleep. So people might think like, well, I'm sleeping, so I'm using less energy, but your brain's still very active. So you're actually using up a lot of fuel. And
Yeah.
this is also one of the reasons why hypoglycemia can be a disruptor for sleep. A lot of people who wake up in the middle of the night frequently usually have nocturnal hypoglycemia. And that particular statement right there about glucose metabolism increase during sleep is one of the reasons why people with poor blood sugar management can have disrupted sleep. So that's a really important point.
Yeah, that's great. I've been recommending for some people who are really trying to get a handle on this continuous glucose monitors for a short period of time, and they actually see this decline during sleep. And I don't know, do you have any tools that you tell like types of food to eat while you're balancing and getting things restored before you go to bed?
Well, yeah, I think it's about stabilizing the blood sugar throughout the day, right?
Yeah,
Because you're not going to just have crappy blood sugar all day and then like eat something really healthy before you go to bed and your blood sugar is going to be fine throughout the night.
so
It's
true.
about how you set up the whole day, including exercise, as you mentioned there.
Yeah,
So, but sometimes people with really severe hypoglycemia, they may benefit from a nighttime snack of
yeah.
some kind of protein that's mixed with some fat, something that'll digest slower so then that glucose level can be held up throughout the night.
Yeah, awesome. Yeah, great, great pearls. Um, so, Peter and I talk a lot about the intersection of, our immune system and detoxification. So I did feel like, even though we're going to focus on detoxification, immunity is so much on our mind these days. And I just wanted to kind of share some things throughout this lecture about sleep and our immune system. So, deep sleep actually strengthens our immune system. And so, I don't know about you, Peter, but I have patients who not only have they're like infection collectors, or they have all these stealth pathogens. And while we need to treat those, I always kind of go back and say, like, what's going on with their immune system? And they tend to have lower natural killer cells, lower levels of subclasses of immunoglobulins. So they're not able to mount a response as well, lower white blood cell counts. So they're, and that's a lot of the work we're doing to repair that. But if you have a sleep deficit, or if you're struggling with insomnia, that is just going to do a lot of disservice to your immune system developing memory of what it continues to encounter. I saw this a lot with COVID. I know a lot of my patients got COVID multiple times, not just once, but maybe I've had patients as high as 6, 7, 8 times. Every variant that came out, they would get hit, whether regardless of vaccination status. And so that really kind of, put this on my mind, like, okay, how are people sleeping? So we make sure that their immune system is actually creating memory and during the day, mounting an effective pathogen response. So those are some clinical pearls of deep sleep. We'll go in a moment to talk about what's happening on the detoxification side, but let me just introduce you to REM sleep. Many of us have heard of it. It's kind of a popular term when we're talking about sleep to think about. And it stands for rapid eye movement. And so this is, again, a stage where we're dreaming more. Our heart rate and our blood pressure is increasing. Our breathing's becoming more irregular and faster. And then we're also like paralyzed. So we're not, acting out those things that, we're dreaming. And that's a whole condition if you are. And this is a time when there's actually more blood volume and cerebral spinal fluid movement through the brain. Another thing that's really exciting about this, in my point of view, is that this is the only time where noradrenaline, a very high stress hormone, it's known as epinephrine in the body, but or norepinephrine in the brain or noradrenaline in the brain. There are kind of some other terms we use for this, but it's actually completely like the brain is void of this stressful neurotransmitter that, of course, we need, but the prolonged levels of this hormone is when we can, or neurotransmitters, when we can essentially, feel stressed out all the time. So we need REM sleep to just kind of allow our brains to just not be stressed out, for us to have this kind of washout period during REM sleep, which we'll talk about some implications of that not happening in a moment. But I just thought that was an interesting clinical pearl I learned years ago that I always like to point out, because I don't know if it's a popular fact, probably in your community, but not many other people know this. So what are some of the benefits of REM? So again, deep and REM sleep are really important. So REM is important for our learning, our memory, our mood. It actually helps us to deal with our trauma, deal with our emotions that are happening throughout the day. When we're in REM sleep, we can have dreams or neuronal connections that allow us to be more creative or problem solve during the day. And then it's really helpful to, again, integrate new information. And we've learned that loss of REM actually diminishes our neurological and psychological processes. So we don't learn as well. We don't have as good a memory. I see a lot of people with brain fog and memory issues. I'm sure you do too. And then also we don't have as good brain detoxification, which we'll talk about. And then lack of REM is also associated with the rise in leptin. You might have heard of leptin. It kind of puts us in this fat storage mode if we have high levels that we can test in a blood test. It's also associated when people have mold illness, that their leptin levels get this misalignment, this signaling. But again, there's other reasons as well. And then that can affect, again, memory, cognitive impairment. And it actually, there's a lot of studies, I'll have another slide on this, on the effect of trauma. So it's a chicken or the egg. Trauma survivors have a harder time getting into REM, but we need our trauma survivors to get into REM to be less traumatized. And so there's been some interesting research in that. There's some things that you can maybe like take a stock of today and to see like, okay, maybe is my sleep not as good? Some of the things that suppresses REM. So caffeine. So especially if you're sensitive to caffeine and overusing it, that can affect your sleep. Alcohol. I think most people realize that they don't get as good of sleep, especially if they overconsume or if they're highly sensitive to alcohol. Marijuana. So I actually do use cannabis and CBD in my practice at times, especially people have a lot of neuroinflammation or in pain. But there is a cost to, especially if you have the CBD with the THC, to getting vital levels of sleep. So, use that in your consideration when you're making those decisions. Narcotics and pain meds. So we have really an epidemic in our country with this issue. And these medications are often used for short-term recovery. So if you're using them to manage your pain, that can, again, if it's prolonged, that can affect your sleep levels, which actually are when you heal and repair and you need that time to get out of pain long term. Benzodiazepines, these are things like Xanax and clonazepam. There is a trend in my patient population. They come to me with these medications. They tend to help them with anxiety or mast cell. Our mast cells actually get more controlled by these GABA medications, but they're highly addictive and they do interfere with sleep. Antidepressants, again, I'm in a place for everything, anti any of this. I just want people to be aware. So if they're having an issue that, they can talk to their doctor, and maybe there are other alternatives as well as getting to the root cause. And then lithium. I
Hey,
also,
Christine,
yeah,
this slides is a downer, man.
I know. I'm gonna get happy.
None of
I,
this is
I
all
know,
good stuff. This is
I
all the good
know,
stuff, but we
I
can't have
know.
it. And
And
then, what's funny is people associate a lot of these medications and substances with better sleep, but in fact, they actually reduce REM sleep.
Yeah, totally. And everybody, I'm just giving, the broad research. Everybody has a different epigenetic makeup and how they have different liver enzyme function and how they metabolize caffeine and how they metabolize these things. And so, again, take it with a grain of salt, but there has been enough research. And again, I'm just trying to share with people if they've been really stuck out there and thought they were taking something to relax them, that actually might be impacting, their sleep. But I agree. And then reduction of REM can affect, can be totally impacted by chronic illnesses and overexposure to EMF. I'm basically said most of this, and so I'm going to just kind of move on to this. So trauma and dreams. There have been MRIs when people are sleeping to show that there are key emotional and memory related structures of the brain that are related to REM. So we talk a lot about the amygdala and limbic retraining and limbic healing when people have had a chronic illness. I'm surprised we don't talk enough about how sleep is an important component to recovering from trauma. There's different emotional related regions of the cortex of the brain, the outer surface of the brain, and then hippocampus, which is really a lot about memory. And it, this REM allows us to heal. We can reduce that charge in the amygdala when we get good amounts of REM. And then there's a lot of people who study dreams. So I just kind of shared that, when we're dreaming, we can sometimes get some spiritual or emotional insights. So again, if you've are a trauma survivor, if you've been through a lot of trauma in your life, the trauma of being sick, if you've taken courses on limbic retraining or rewiring your brain or healing your amygdala, doing EMDR, all of those really awesome things, just know that good sleep is part of that process as well. And then, we found that in PTSD, people haven't really detoxified from their emotional trauma because their REM pattern is interrupted. And we need, this time when the brain is devoid of noradrenaline, but PTSD patients have higher noradrenaline and they have a harder time getting into REM sleep and more nightmares. And so this doctor actually, where I'm from, UW Seattle, a long time ago, found that just very kind of synchronistically found in vet populations, veterans, that they gave a blood pressure medicine that lowered their noradrenaline and they could sleep and they got out of their PTSD because they could get into REM sleep. And so we have other tools we're going to be talking about and how GABA is a really good agent and GABA can do this as well. But I think that's just, again, I know a lot of people in this community have PTSD, so I wanted to mention that. So GABA has many, many uses. And one of the things I wanted to highlight after that slide, it really puts the brakes on noradrenaline and can help us get into, especially if we have a harder time transitioning into REM sleep, it can support us to get into that REM sleep so we can have that noradrenaline washout. And it makes us feel good. We have more of a calm mood, lower anxiety, can help with stress and depression and headaches. And it can be low, especially if you're dealing with a chronic illness. So, some references again, I wanted to give us a robust kind of overview of sleep before we got into some deeper topics. Um, so Peter knows I love to talk about this, and I think it's just really important because I see patients from all walks of life. I was talking to a family today that was a new patient, and they had a 6-year-old child they have with PANS and PANDAS, and I was educating them on the impact and the importance of the glymphatic system, and they had not even considered that in their journey thus far, and they were using intense medications and trying to also balance that with holistic approach. But I just don't think we've realized what an important system this is and how it's our ally in detoxifying our brain and having really good cognition and preventing cognitive decline. So the lymphatic system is the glial dependent lymphatic system. Glial cells are one type of them are astrocytes, which are these star-shaped immune cells that help to not only kind of take out the trash in the brain, but they actually help to regulate the fluid of this lymphatic system, bathing our neurons at night and removing waste. And so when we sleep, especially in deep and REM sleep, our brain shrinks and we make a room for this really fast flow of this lymphatic fluid to come alongside our arteries where the oxygen rich blood comes in. And these astrocytes, these star shaped immune cells, have these what we call aquaporin channels. There's a lot of research on aquaporin 4 channels and hydrocephalus and traumatic brain injury and just any swelling of the brain that some people get when they're not feeling good from these chronic illnesses that are in the brain. So these aquaporin channels regulate the flow of this fluid. It takes the trash out, the metabolic waste, and also the accumulation of environmental toxicants that we find in our brain over time. And then we have this flow of fluid that exits out along the venous system. And this second picture shows if somebody's had a traumatic brain injury, especially multiple. I know Peter educates a lot on this and the impact on the brain health, but it actually damages this astrocyte network. And so there's actually incomplete kind of transfer of nutrition and oxygen to these neurons and an incomplete removal of waste. And so we have this buildup of things like amyloid beta that they've documented, and even poor sleep and traumatic brain injury. And then again, that environmental toxicant load that we're going to talk about starts to build up. So we need deep and REM sleep to have optimal functioning of this lymphatic system, and we need a healthy routes in and out of the brain that we're going to talk about. I finally found a paper on this, which was exciting to me. So when we talk about the lymphatic system, one of the first things we want to know is that there's a good route out of the lymphatic fluid out of the brain while we're sleeping. The lymphatic system is like a highly interconnected network. And if there is stagnation or basically pooling or not enough ways out for the lymph, then it can back up in the brain. And then there can be more metabolic waste and more toxicants that build up in the brain that can affect essentially neurons that eventually die because they're so overwhelmed. So the two kind of areas that we're going to talk about are through the cribriform plate in the sinuses. That's why sinus health is so important to healthy brain health. And then the tonsils and the cervical lymph nodes. So all of that is a really important drainage system for the brain. So this paper finally shared that there is a major route of cerebral spinal fluid that gets circulated and that exits the brain through the cribriform plate that if we did a cross section of our head, we would see that on the top of the sinus. And then we have this, window also on the other way on the window into the brain through the sinuses as well. And then what happens is this lymphatic fluid, this is another picture, gets drained through the sinus floor here, and then it makes its way to get drained through the Waldeyr's ring. And Waldeyr's ring is what we know and what we call commonly the tonsils. So we might have all had our palatine tonsils removed. We might still have them, but those are the tonsils that we all kind of know that are at the back of our throat. We have the adenoids, we have the tubal tonsils, and then we have the lingual tonsils. So that whole ring of lymphatic tissue is critical to our health. It's critical to our gut health. It's critical to the drainage of our brain. It's also critical to have a healthy tonsil kind of ring, so we don't have a reservoir of infections that migrate up into the brain and keep our brain hyperinflamed. And that can be in the nasal passages too. That's a lot of the pathology with PANS and PANDAS. We also think about the cervical lymph nodes. So there's a lot of lymph that exits the brain through the jugular venous system. That is also the lymphatics are that are surrounded or the jugular veins, these cervical lymph nodes. If you've had chronic infections like Epstein-Barr or Bartonella, you can feel often the lymph nodes actually kind of feel like a necklace that you can actually palpate. They might be small, they might be large, you might not feel them. And it's really important that this route is really open. It's, again, this chicken and the egg idea. A lot of the reasons why people need better sleep and better lymphatic drainage are also the things that are impairing them from having it. And so we have to look at it at both angles, and we'll come up with some good suggestions today. But think, okay, if we want to have healthy lymphatic drainage, which is the foundation of detoxification in the brain, we detoxify normal metabolic waste like tau proteins, amyloid beta, and then we get rid of viruses that don't belong. We get rid of heavy metals, and then other toxicants as well. So those are the studies I've read. I know for sure that we get rid of, viruses and heavy metals, but I just assume if we have a good lymphatic functioning system at night, we know that our body is working for us and not against us. And then again, I've already mentioned this, but the deep and REM sleep are the times when there's more fluid, there's more drainage happening, more blood flow, more cerebral spinal fluid flow, more lymphatic flow in the brain. So that's why when I first learned about this, I just thought, okay, just take melatonin, fall asleep, which melatonin is awesome for many reasons, which we'll talk about. However, we need to stay asleep and we need to get into those deep and REM states, which are not always the same thing. So since we're talking about toxicants and why we really need to detoxify the brain, I could not talk about the pineal gland. And so the pineal gland is this pine cone shaped structure that sits in the center of our head. And it really, when we think about circadian biology and circadian rhythm, it's an important part of helping us to go to sleep, because we take the light in our eyes, whether we're in sunrise during the day or sunset, and that's giving us environment or giving our pineal gland information in our environment, rather, that gets translated to the suprachiasmatic nucleus and then talks to the pineal gland to tell us whether it's day or light and what time it is. And it takes that light information and transduces it into hormones like melatonin. The pineal gland is also sensitive to magnetic fields in our environment, and allows us to sense season and kind of where we are in our cycles. It is said to be produced at its peak around 2 to 3 a.m. when it's the most dark at night. There's a whole esoteric, wisdom around the pineal gland. It's often referred to as the third eye in meditation circles. There's a lot of conversation about how this is an access point for deeper states of consciousness. And it's very vulnerable where it sits, and its access to blood flow and kind of what it is vulnerable to fluoride. So everyone here, I hope, has a water filter that they know fluoride is getting out of their water. Water is really a great place to start with detoxification. We all ingest water, and our water, unfortunately, can have not only fluoride, but other things like aluminum sulfate, which they use to clean the water, or glyphosate compounds. I have friends who are saying, hey, like, it's not just aluminum and the fluoride, but there can be these complexes like aluminum fluoride complexes that can actually get into the brain and the body that are even worse than, you know, them alone. And there's this synergistic effect that we just don't have the science to support. It's just people like Peter and I just see the downwind effect of this, and we're doing the best we can to help people heal while science is catching up. Glyphosate affects the pineal gland. Aluminum is a heavy metal with a high charge that's very strong binding in the body. We know that children with autism and people who've had Alzheimer's, when we do autopsies, there's a high, statistically significant higher amount of aluminum in the brain. And so check your personal care products. Again, filter your water, look at your pans, look at your medications. Look at dyes, the aluminum like dyes, and red and blue color agents are aluminum. So we want to avoid exposure as much as possible. And then EMF is also. I gave you a couple slides. I could do a whole lecture on EMF, but EMF is also another toxic environment that is impacting us more than we probably know. And so some of these things we'll talk about, like meditation can be supportive for the pineal gland, just that activity, especially if you have breath work. Melatonin itself, the thing that the pineal gland secretes, is actually a detoxification agent, and also helps us to have a healthy glymphatic network. So it's also supporting the brain to detoxify itself. I love structured water, but just even filtering your water with fluoride can be enough. Binders like fulvic and humic acid, zeolites that are tested for aluminum, chlorella, charcoal, clay, all of that. I've been using a lot of blood filtration in my office to help mitigate some of this as well. So we know the connection between the pineal gland and melatonin, and all the things I said, but this was new years ago when I started really using GABA more, about the relationship between the pineal gland and GABA. So we have these cells in our pineal gland called pineal sites, and they take up GABA from the extracellular space, and they use GABA to help signal the pineal gland to shift into different states, and it helps to actually assist REM sleep. So GABA supports REM sleep, which is also a highly active time for the lymphatic system to detoxify the brain. So we also use GABA not only to induce deep and REM sleep, but it also helps to the pineal gland to signal the REM activity. This is a book by our colleagues, John Lawrence. He did a good job of putting a lot of literature together on melatonin. People have all sorts of ideas around melatonin. If you take it, you won't produce it. I'm just biased in the world I live every day, and I think melatonin, we're all in a very deficient time. We not only need melatonin from our mitochondria, or our pineal gland, but also our mitochondria and our gut microbiome. And many of the people who are in our offices have mitochondrial issues, and so melatonin actually helps to quell the reactive oxygen species that get made and produced when we make energy and metabolic water. Most of us have gut issues in America for obvious reasons, and so we're not making enough of their precursor serotonin to create melatonin in the gut. And then it helps actually bile flow. It's also this whole other agent, and we need bile flow, not only lymphatic flow and good sleep, but we also need good bile flow as an exit route. For the body. It's a huge source of elimination for the liver in our phase 1, 2, and 2.5 and 3 detoxification. It's also noted in the FLCC protocols for COVID because of its anti-inflammatory and also antiviral properties. Liposomal melatonin I'm a fan of. There's also suppositories. Do you have a favorite melatonin, Peter?
No, I think, in my experience, they all work to some degree. I do want to highlight that the melatonin, it is very important for immune function. If you think about it, when you're in deep sleep, while you're sleeping, your brain, your pineal gland makes a bunch of melatonin. It peaks around 2 to 3, and that's when the melatonin pushes Th1 response. So
Mhm.
then when you push T helper 1 response, you improve innate immunity. So then you kill bugs while you're sleeping. How
Yeah.
convenient, right? So that's how the way it's designed. So if you're not getting deep sleep, if you have melatonin deficiency, that can all compromise your ability to get rid of infection. So a lot of people with chronic Epstein-Barr or whatever infection they're trying to get rid of, if you're not getting good sleep, it's hard to get rid of these infections.
Yeah, I love it. Yeah, no, so good. And um, just one slide, I think, or two on about EMF, just because that is a toxicant and it's impairing our detoxification ability these days. And so this was a kind of a startling but true picture between 2004 and 2022. I think the iPhone came out in 2007, and so it's just a map of increased electrosmog, which can be cell phones and Wi-Fi or the proponent signaling, but there's many more microwave and other EMF that's put out into the environment. And there is an impact on EMF and melatonin. So they looked at pineal gland production of melatonin in a kind of like a 50 to 60 hertz environment and how that affected melatonin production. And they did find a change in that production. Many other things I've seen be documented, but for the purposes of today, and we'll talk about the whole what we can do in our sleep location and sleep hygiene as well. You already mentioned this, but sleep improves our T cell function, right? So we're going to be able to fight intracellular infections, and our stress hormones inhibit what we call these sticky proteins called integrins and adhesion molecules. So during sleep, especially REM, we're devoid of this adrenaline, and so these hormones are lower, and integrins are stronger. So we can actually the stickiness of the integrins and the T cells can attach more to the infection and the viruses or the infection to actually create a decrease in microbial or viral burden. So that's another interesting angle. Again, we see a lot of neurological conditions, both of us, and sleep. When we study sleep, sometimes we deprive people of sleep and then see what comes out. And so there's been studies on Alzheimer's and Parkinson's and pain and epilepsy and gliomas and autism and stroke and MS. And again, sleep is essential to heal the brain. If we don't have sleep, it affects our circadian rhythm. It affects these misfolded proteins in the brain, like alpha synuclein and amyloid beta and tau, that are linked to Alzheimer's and Parkinson's, and impairs the glymphatic system. So we have more accumulation of these faulty proteins in the brain. It affects our immune and redox systems. And then, we really need to get good sleep to have healthy brains. Many of you in the audience probably have had a mold or mycotoxin issue. And clinically, we actually hear when people are in a moldy environment that they can have more insomnia as well as nightmares. And mycotoxins can affect many neurological pathways, of course, and they're, of course, going to be very inflammatory. We know Bredeson's work, there's type 3 or inhalational Alzheimer's, from mold and other environmental toxicants. But it can also suppress the GABA producing neurons. So that's going to affect our stages of sleep that are important. I don't know if you talk much about pyroluria in your, the way that you educate about the brain, but this is a condition, especially if you have a neuropsychiatric condition, and trying to get to the bottom of this could be a good place to look. We make hemoglobin, and on the way to hemoglobin, we make these metabolites called cryptopyrroles. And when we have pyroluria, we make a tremendous amount on the way to making hemoglobin. And when they are excreted from the body, they cause a lot of loss of zinc and B6, which actually are critical to neurotransmitter and hormone and detoxification. So this can also affect GABA as well. So making that neurotransmitter GABA. There's a clue when people have pyroluria. Not only are they maybe having a neuropsychiatric diagnosis, or they're really sun sensitive, they don't like the sun, or they can't dream. They have poor dream recall, and then therefore a more of a buildup also of their detoxification methods, and more neurotoxicity in their body and in their brain. There is a good lab. I just wrote it for people to ask their doctor about, but DHA lab actually is a specific lab for looking at cryptopyrroles and the sequelae to that in the urine. I mentioned EMF already, but EMF also affects REM. So they did this in an animal study. There's a lot more human studies that need to be done, but they are noting that in animals. So this is really interesting, and I know you see this too. So we know we need the immune system to fight infections, and there's lots of mechanisms while we sleep, right? And many people who have chronic infections can't sleep, right? So I think of that as one of the number one causes of insomnia, aside from everything else I shared. So this is a good paper, the only one I found who note that I give people ivermectin or antivirals and they sleep. And I'm like, why is this? And there is this bidirectional communication, and there can be immune activation, especially from the periphery or the gut, that has pathways and networks to the brain. So there can be a lot of high cytokine or inflammatory messengers in the brain at night when there's an underlying infection that has not been treated. So have you seen that, Peter? Or I'm sure you've read a ton about this.
Oh yeah, actually,
Yeah.
I think what may be happening there is a vagus nerve connection, because your vagus nerves,
Well,
through
it's
the
the path.
inflammatory
Yeah.
reflex, yeah, dampens cytokines. So
Yeah.
if you're very inflamed because of an infection, you can have a lot of cytokines, and then that can put you. By the way, cytokines like interleukin-6 stimulate midbrain mesencephalic activation, which
Yeah.
makes you more alert. So that could disrupt sleep in and of itself.
Mhm.
So inflammation can disrupt sleep from any source, including infection. And then if you have decreased vagus nerve function, then you can't dampen that cytokine, then that's going to just stimulate the midbrain even further. So there's a cycle there for sure.
Yeah, I like this picture too because it kind of follows the vagus nerve a little bit, and the pathway. And I've seen when people use vagus nerve stimulators, I know you're a fan of that, they sleep better, so I see that connection as well. So awesome. This is a more complicated paper, but it's basically talking about what happens when we have sleep deprivation and how that affects our innate immunity, keeps our interleukin, our pro-inflammatory interleukins high, and doesn't allow us to actually get into that good stages of sleep, like REM and delta wave sleep. So a lot of words to just say that essentially. So what do we do about it, right? And anything that I missed, or anything that you want to, before we talk about what to do, like anything that you really want to make sure we highlight around immunity and detoxification while we sleep?
No, I think you're hitting right on the head. Everybody, please put in the chat. How are you guys liking this so far?
Oh,
Is this great or what? Is Dr.
yeah, thank you.
Christine giving you guys useful information?
Oh,
Yep.
thank
New
you.
information, helping you to put it together? Let me
Yeah.
know in the chat.
Oh, thank you. Yeah, no, and I'm happy to
That's
answer
great.
questions at the end too. But I'm just trying to share just some of the highlights. This could be like an all day lecture between you and I. So our goal today is to help you get good sleep so you can detoxify and have a healthier brain and just a healthier life, right? So I just want to give some clinical pearls to sleep, and some solutions as well. So I'm a big fan of this idea of circadian lighting. If you know me, I also love to talk about quantum physics and photobiomodulation and photodynamic therapy. And so this is kind of like an intersection with this. And we are very sensitive to our light environment. And so many of us have maybe what we call malillumination in our environment, where we're confused about what time of day it is, because maybe we have an overexposure of blue light during the evening and not enough blue light in the morning, or we're not getting outside enough. And there's a lot of feedback that our eyes get to tell our brain about sleep. So this is very common information now, but just to make sure that you're doing this, you want to minimize blue light exposure between 2 to 3 hours before bedtime. You want to use screensavers if you're using your devices. And then I found, I met a new friend, Rudy Nafsif, who makes Viva Rays. I've been using them. He actually have circadian glasses, and they're not just blue blocking. You can wear them with prescription. They let the UV in because our eyes actually need UV light. The sun gives us everything from UV to infrared. And then he has different lenses that magnetically click on the glasses during the day. So you can have the extreme red right before you're going to bed to calm your pineal gland. And then there's a daylight and a early evening glass. So I thought he did a really good job. And he had ADHD, and it really calmed his brain and kind of fixed it. And so he just felt really passionate about it. And then light bulbs. So we can have light bulbs now that are health promoting, and that we can change the light that they're giving depending on type of day. So I always use the example that I do work when I go to bed, or when I put my daughter to bed, and I put red light in my office. So I, am still getting, tired at appropriate times and not overstimulated. So there are a couple, light bulbs that do that. So Nick Pino, our friend, has a great book about EMF, and he has this, just little checklist. So one of the easiest things to do for when people have insomnia is to correct their EMF environment and their sleeping location, and it really helps. It can feel like more work, but it does really help. So where are you putting your tablets and your cell phones and your computers? Do you have a digital alarm clock, or is it Bluetooth? Do you have, different like air filtration, or a chili pad, or a CPAP, plugged in? Do you have an electric bed? Do you have metal springs? Do you have a grounding and earthing sheet that is actually grounded? Do you have a bedside lamp? And out of all of that, this is kind of where I feel like I learned. So distance is your friend in creating a safe sleeping location. So we want to, with EMF, so we want to make sure, of course, we have a dark room with blackout shades. Again, I could do a whole EMF lecture, but there's just for the purposes of the talk, think about cell phones, Wi-Fi, and dirty electricity. So dirty electricity is the wiring in your home, where it could be a disharmonic signal, electromagnetic field that's generated that's very confusing for our electromagnetic body. And so some Germans figured this out, that you can put a little meter in your outlet, and you can say, do I have dirty electricity? And then you actually put a filter that harmonizes the electrical field. It really helps people who have chronic insomnia. I do advocate for removing electronics from the bedroom. If you could just drop them, in your other location before you go into bed. If that's really hard for you, at least don't sleep with it on your face. Put it away from you, at least a couple arms length, and put it on airplane mode. And then if you're somebody who's really sick, I encourage you to maybe measure EMF in your bedroom. You can consult a building biologist or do shielded healing. If you're going to make some drastic things, if you own your home and you're going to shield or fix things on a deep level, you want to have a consultant, because I've seen these things go wrong too. So you want to make sure you're not exacerbating the issue. If you want to sleep on a gentle 5-degree incline, that can help with lymphatic drainage at night from your out of your brain. I have some friends at Samina. And then air filtration, you want to at least have the air filter away from your head and your body, because when anything's plugged in, it has an electromagnetic current that's being generated that some people are sensitive to. But you want to be breathing good, healthy air. And there are many more things, but I've distilled it to that. It's nice to feel cool. I know you live in Arizona, Peter, but open your window, put on the air conditioning, consider a chili pad. Women who also are going through hormonal changes, or if you have a co-infection like babesia, you tend to sweat at night. And that can really be interrupting into your sleep. So I sleep with a chili pad. I like that. Again, my box that's actually plugged in is at the end of, away from my body in my bed. So distance is my friend there. And then maybe some nighttime rituals. So um, having a consistent bedtime, avoid eating if you're not hypoglycemic, avoid stress, relax, just try to chill out before bed. So I wanted to share just kind of everything I teach my patients. And then out of that, I really created a few products, not only for the lymphatic system, but truly for the glymphatic system. So we developed a GABA. GABA is really poorly absorbed in the body. And so we developed it with and added what we call chondroitin sulfate, which is a proteoglycan that you can apply to your temples or behind your ears before bed. And it really gets the GABA into the brain. We've seen all sorts of sleep trackers that improve deep and REM sleep and sleep latency. We've even done a study to see the changes in brainwave. So again, transdermals, I'm a big fan because people have a lot of GI issues and, who see me. So transdermals are awesome. This is one out of many of before and after just from one use of somnium. And I see this with my patients as well. This is definitely something that's repeatable. You can read some testimonials on our website if you'd like. And then this is a article that they showed improvement in sleep quality and then also relaxing brain waves that were generated from somnium. And then this will help you fall asleep, stay asleep. It's going to help your lymphatic system work better, which is going to help detoxify your brain. It's going to help you if you're traumatized and you need to do limbic retraining and you need that REM sleep in order to heal your brain and heal your trauma. And you're having a hard time getting into that REM sleep. It's going to help to lower that noradrenaline. I'm comfortable talking on Zoom, but if you put me in front of like 900 people on a stage, I get nervous for a moment. And so I use somnium on my body to just relax before I'm doing something stressful. It's great for meditation. I love to meditate. I go to meditation retreats if I need to enhance that, or if I'm having a hard time meditating, I will also play, I'll use it beforehand. And then we apply it again to the temples and behind the ears. This chondroitin sulfate gets into the interstitium, that gets into the lymphatics, and then crosses the blood-brain barrier. I also shared the lymph flow because that's going to help drain the glymphatic fluid out of the brain and also just be an awesome lymphatic tool. I hear so many anecdotes every day on lymphatic drainage. I saw a patient just before I got on who has a tooth that she needs to remove and her breast was swelling and she was using lymph flow before night and it was really helping just draining that lymphatic tissue. Again, we want to drain the cervical lymph nodes to help drain the brain at night. And then other areas, whether you use lymph flow or any other technique or strategy, along the collarbones are good to get that exit route for the lymphatics to go into the circulatory system. The armpits, you can put it over your liver, your kidneys, the bikini line where the pelvic floor lymph nodes are, behind the knees, bottoms of the feet, pain. It's not always effective, but it can really help with pain, and then scars. We also use plant stem cells that come from the buds of beautiful plants that are grown in the Italian Alps, and then we make them in a glycerin and alcohol macerate. And then I had the idea to add phosphatidylcholine, and so then enhance their drainage into the lymphatics. So I just see what's missing. I love products like Peter's out there. And I'm just, again, finding what I find is missing. So there's some very potent drainage remedies for our time for the lymphatics, the gallbladder, and the spleen. And then we have a bonus. I created 2 courses that are really helpful. The 7-day lymph blueprint that I invited all my dear friends who really talk about the lymph all day long. And we're sharing those with Peter's community, and then a neuro detox. I should have had you on the neuro detox. You were probably busy. I'll have you on the next one, Peter, because this again was just supporting sleep, detoxification, and optimizing. health. So, okay, we did it. I'm happy to answer questions.
All right, that was awesome. Thank you so much.
Yeah, of course.
And I'm going to put the link here. We'll
Okay,
send out an
great.
email tomorrow as well with the link to Dr. Christine's store that you can get a discount.
Mhm.
So I don't know if this is going to, there you go. I think that's clickable.
Yeah,
So if you
perfect.
click on that, it'll take you to Dr. Christine's shop and you'll be able to receive great discounts on these products for you to try yourself if you haven't tried them already.
Mhm.
Okay, so and then we'll open it up for a few minutes for questions. If you have questions, please go ahead and just put it in the chat instead of the. I see some people may have put something in the Q and A, but yeah, if you could put the question in the chat, that'd be great. So then we could just see it. There is a question here in the Q and A section, so I'll just. Oh, she already answered the question. Great. Let's see here. And if no question, no problem. Let's see here. I always have my Swanix blue light blocker on when on laptop or watching TV. I also order EMF filter from Thersage. Would you say it's good for EMF at home in addition to the Harmony pendant? Thank you for your time. Likely going to be ordering your insights and products. Okay.
Thank you.
So what do you think? Do you feel like those pendants and the Harmony pendants and the like EMF filters do they help?
Yeah, it's a good question. In my early days of learning about EMF, I would probably say avoid them. Nowadays, we are inundated, and there's really no safe place where we're not surrounded by increased electrosmog. Some people are more sensitive than others. Nobody should feel it, but the people who feel it do have a condition, and there's all sorts of ways to decrease sensitivity. I always turn to the physics. How are you using your cell phone? That is going to be the number one way to reduce your, exposure. Are you sleeping with the cell phone in your head? Is your Wi-Fi router right next to your bedroom? Move it, turn it off at night. Those are going to be some good strategies. So do that first. And then I do hear clinical anecdotes all the time about how the harmonizers and pendants help people. They're just very variable. I haven't put my stamp on just one because what works for one person doesn't work for another person. I've just seen that pretty dramatically in the EMF world. But I do feel I interview a lot of people on my podcast who create them because I'm just curious, and I'm sure it will help a lot of people. But I want people to do the basics. Our sleep location is, hopefully 8 hours of time where you're in one place. If you can reduce your exposure as much as possible in your sleeping location, you're ahead of the curve for sure. So
Yeah, I agree. I think in
yeah,
it instead of, I mean, not instead of, do what Dr. Christine suggests first, which control light, control your location, control EMF, even control your blood sugar.
yeah,
That's going to have a much more important impact on your sleep than, getting a little tiny little filter on your phone. The way I think about those filters, the pendants and the stickers on the phone, they may work and they probably do work, but it's kind of like if you, and with so much, you saw the picture earlier, Dr. Christine show with so much electro smog. I mean, it looks like a bomb went off.
I know.
So, if you're standing outside and there's a category 3 hurricane going on and you're out there with an umbrella, you're
Mhm.
still getting wet.
Yeah,
So,
yeah,
so it's better to just not be out there in a storm. That
yeah.
means get as far away from the EMF as possible. That's going to be the best way for you to not get exposed. Of course, it's going to be difficult. So that's why you use those devices to mitigate, cumulative effects of it. So
Yeah, I love that. Yeah, we're on the same page. Peter and I
yeah,
are on the same page in many ways. We go to lots of conferences together, and we're like,
yeah.
I believe that, don't you? Yeah.
Now,
So
Claudia had a question. What do you think of CPAP machines as far
yeah,
as sleep?
yeah, it's a good question. And honestly, there's no perfect answer. We just don't have a technology that's taking this into account for people who have sleep apnea. I think there are more and more opportunities and devices coming out, but there is a huge risk factor for your brain health, your longevity, your cardiovascular health if you have sleep apnea. So I would, if you have sleep apnea, I would, quell the fire, do the CPAP if you tolerate it. Ways to avoid that are, weight loss, also looking at your airway and looking at your tonsils and looking at your bite, and also your nasal passages. So working with a really good team between a great biological dentist who has a lot of um, uh, experience with appliances and tongue placement and all of that. I mean, there's not one strategy for everyone. So I think CPAPs are not like the most elegant solution. I think we need to strive for better. But I think if somebody has sleep apnea and not taking this holistic approach, it's better to have a CPAP than not, because of the low oxygen at night is devastating for the brain and for your health.
Yeah, definitely. I mean, you got to get fuel, you got to get oxygen to your brain, right? So someone who's actually have obstruction and they're not getting enough oxygen to the brain, having a CPAP machine can literally just turn their life around. However, it's not addressing why you're having sleep apnea, because some of these causes are lifestyle related.
Yeah.
So, see sleep apnea as a holistic issue and address it holistically instead of just having the CPAP machine and ignore all the other parts that you can help with.
Yeah. Yeah.
Uh, Pieta asks, I have both tonsils and adenoids removed as a child. Anything I can do to assist in their absence?
Yeah, good question. So the tonsils are definitely part of the lymphatic system. They're important in the lymphatic network and the gut priming of the immune system. Many patients have had their tonsils out. Many patients, honestly, who have a lot of issues and have neuropsychiatric symptoms or pains, pandas, high anxiety. Sometimes we even take the tonsils out, even as a naturopath. I do bias for getting people better, and it's helpful. It's not a very accessible treatment, but if you can find somebody who does neural therapy, will actually inject the scars in the back of the throat that actually open up any scar tissue that's impacting lymphatic drainage. If that's not accessible, I like propolis sprays. I think the lymph flow I use as a lot of a mitigation tool as well. And I would encourage you to be curious with those things.
Great. Now we have a couple of questions on how much REM and deep sleep do we need ideally? Another person asked how much REM and deep sleep based on age, and
Yeah.
how do you answer that?
Yeah, good question. I don't have like all of those nuances with age and um, body type and condition, but really, again, I don't even know if the literature says that at this point, but typically, we go through these cycles in an 8-hour period of time, about 4 to 5 times, and REM can be anywhere from 5 to 30 minutes, and then deep sleep can be longer. So we actually sleep and deep sleep more than REM often. So there are sleep trackers that have found algorithms based on AI collection of data to find what's normal. So I actually haven't looked at that in a while. I don't use a sleep tracker, but you can see the scores or the recommendations. But I just remember this story, this little anecdote. I have a patient who's very dear, and he was getting 2 minutes of deep sleep a night on his sleep tracker. Again, is it fully accurate? I don't know, but let's just say it is. And he put Somnium on, and the next night he got an hour and 20 minutes of deep sleep, and he felt better. And we're biasing for, feeling better at the end of the day. All of these things that we just noted, if you're not having issues and you're sleeping 8 hours and feeling refreshed and, great, then you're probably doing what nature intended for your sleep cycle. So,
Yeah, I agree. I don't think, I think the question implies that, oh, there's a way for you to manipulate how much. Okay, I was getting 20 minutes of REM sleep. So if I do this one trick, I can get like, you know, 50 minutes at this time at 3 o'clock in the morning. I don't think it's that specific, right? I think you should look at REM sleep and deep sleep in a holistic way. Use somnium, right? Use lymph flow, use to control temperature in your room, control your exercise, your sleep, your diet, control inflammation. If you do that, then you're natural, and make sure you get enough quantity of sleep as well, right? Don't go to bed late watching Netflix. So if you do that, then your sleep will naturally get to where it needs to be over time, right? So that's what you want to think about. I mean, one of the ways that I tell is not necessarily just with a tracker, is whether, like I have patients who tell me like, hey, I haven't remembered my dream for years. And after I do XYZ with you, now I'm remembering my dreams. Well, that's a positive because during REM sleep is when you sleep. So when you dream. So the fact that someone can recall their dream, that's one of the markers or symptoms that I look for that tells me that they're improving.
Yes, I agree with you, Peter.
Couple people asked a question on grounding pads, grounding mattresses, grounding sheets.
Yeah,
Like what's the best one, or what do you think of
yeah.
them?
Yeah, I think they can help. I do. I mean, the idea is that you're getting electrons at night when you're sleeping, and that we're kind of manipulating kind of that idea that, when we put our bare feet in Mother Earth and get electrons from her, that we're doing the same thing. I've seen them work. The biggest thing, if you're going to use one that plugs in, you've got to check from Home Depot if that outlet is grounded. I've seen that go wrong where people plug them into an ungrounded outlet and they get very anxious, and it does the exact opposite. A more kind of premium grounding nut on the market is from Samina. It's called Locasan. It's made in Austria. It's really like the Cadillac. And then if that's not within your budget, there is Dr. Steven Sinatra has passed. I know his son, and they have kept his website and his company going, and he sells grounding nuts. He's one of the first cardiologists who acknowledged it, EMF and grounding, and he has created a grounding pad. I would look up his website as well.
Great. And a couple more questions. One person, Mirella, she says, I live in a large apartment building, EMF from all the residents. How can I protect myself besides getting a cage?
Yeah, it's a good question, and it's hard, it's not easy. But what I would do is, there's a couple things I would do. One is, if it's within your budget, there are tri-field meters now on Amazon that, I mean, they're not going to be the best on the market, but they're like decent, where you can, see kind of where in your apartment are the hot spots, and actually try to move your bed around that you're not in a hot spot. So people like Nick Pineal, he has a great book. There's also the people who sell the Y Shield paint. I forget what their names are, but they have a good website where they say all the measurements that you need to be looking for. And then do what you can in your environment. So again, where's your Wi-Fi router? Is it off at night? Where's your cell phone? And then you might want to do some things to mitigate. I mean, you're talking about maybe doing the sleep canopy and the Faraday cage. If you do that, I don't think that's always the best idea, because we are blocking things that we need to experience, but if you're highly sensitive, do that, but make sure you're testing it, it's grounded, you're doing something on the bottom of your bed so you're not getting EMF from your neighbors below, and then containing it in the Faraday cage. And then maybe a grounding mat would be good. And look at dirty electricity. That could be something that you mitigate and you have the power to do. So I would just go through some of the slides we shared and just make sure you're doing those things.
Just a little broader context as well, Marilla. If you live in an apartment, you have EMF from all the residents, you have to ask yourself, what are you trying to fix? Do you have symptoms? If you're like, I sleep great, I have no problems, I feel awesome, then don't worry about the EMF. You have to prioritize the problem, right? Like for somebody the diet is terrible and they never exercise and there's EMF, prioritize, clean up the diet and exercise and worry about the EMF later, right? So then you can like do the most impactful thing for you at this moment in time. So I
Mhm.
see a lot of people kind of just go in the other direction and started chasing down these other things, which might be a part of the problem, but they're not addressing the most important problem, like having lights or phones right next to the head, and they don't fix that, but they're worrying about these other things. So
Yeah.
prioritize. I think last couple questions and we're done here. What are your thoughts on healing frequency music for enhancing sleep and overall well-being?
I'm a big sound healing fan. I love music. I love studying music. I love studying the impact of music on the brain and the body. And again, kind of it's what Peter said. Does it help you fall asleep? Do you feel good from it? Do you feel relaxed? We, in our office, we've done sound baths that can be really restorative. We have a little device called the AO scan that gives you healing frequencies that you can listen to that are really relaxing. On YouTube, you can Google up a sound bath for free, or just healing frequencies. And again, it should drop you into parasympathetic and you should feel relaxed. And if that happens, that's the right thing for you. If it doesn't, it's probably not.
Right. I mean, music can have an amazing effect, can ramp you up or can really calm you down. So it's not that the healing frequency music is going to, have some magic in it that's going to magically make every single person's sleep problem go away. If that was the case, that'd be great. Unfortunately, it's not, right? So we have to be observant of the effect on you. You can give it a therapeutic trial and see how it works for you. Last question. Do sleep trackers have EMF issues?
Yeah, they're low level Bluetooth usually, which is probably the least amount of radiation. But again, some people are sensitive to it. I just recommend recording your sleep with your airplane mode on, which most devices have an airplane mode, and then you can, when you're not sleeping, you can turn it on, and the device can connect with the app, and then you can get that picked up.
Right. And also, do you ship to Canada, the your apothecary?
Yeah, we do. Yeah, we have
Great.
lovely Canadian patients and friends.
Awesome.
Yeah.
All right. And old-fashioned wind-up clock better than electronic clock? Always. If you can do that. Yeah.
I know, if you have access to that, awesome. You want to think about with your clock, you want to think of the EMF exposure and the light exposure. You don't want those like obnoxious hotel, you know, clocks that, have that bright light that are keeping you up and overstimulating you at night. So
Right, right, right.
big count. Yeah.
This is a great question. Can you use somnium and lymph flow together at the same time?
Yeah,
And
it's a common thing that we do. So we use somnium here, lymph flow here, to like that's how it was intended to drain the lymphatic system. You can combine them though and kind of put them on your neck together. You can combine them if you have pain. GABA is used for pain, and some people have found that you can put it over your vagus nerve as well. And there's all sorts of, there's no wrong way to do it. The fun people, like the fun part of my job is to hear like, okay, this is how we created it, but these are the anecdotes. And just trust yourself, trust your body. It's okay to get creative. These are very, very safe products.
they're safe for kids because I have my kids use it too.
Yeah, I put somnium on my daughter when I'm like, okay, she's going to be up a little bit, she's chattering, she's like not tired, and she's like, don't put it on me, I want to stay up. And I'm like, no, we're gonna put a little bit of somnium on, and she's like out in a few moments. Yeah.
Yeah.
And it's safe. It's a low amount of GABA. It's a proprietary blend, but it's a very low amount. It's just the why it works so well is the delivery mechanism.
Right. And
Mhm.
just one last one and we're done. How to calm mind chatter that keep you awake? Somnium.
Yeah, somnium. Yeah, somnium. Well, it could be a lot of things. So, like, what's your life like? Are you have a situational stress, or are you recovering from trauma? Do you give yourself enough spaces during the day to offload your brain and journal or talk to somebody, or put that stress somewhere else so it's not up when you're having your first calm moment? Are you meditating? And then do you have some, maybe epigenetic SNPs that you have a harder time breaking down your stress hormones like COMT, and need more magnesium, and other things that I love Hanakiel too, from Dr. Eliza's former company, Ecogenetics, that non-chatter kind of cortisol kind of spike at night on a pure with melatonin and GABA can sometimes just really get the brain settled. And just try to relax before you go to bed. Don't feed your brain a ton of information before you go to bed. But I'm curious what you have to say too.
Yeah, I think most people they know most people know why they're having problem, right? And if you really just sit with it, you kind of know, oh, that I'm probably watching TV or I'm probably stressing out about something, and so you probably already know the answer. You just gotta really, take it to heart and implement. So, all right, awesome. That's all the questions here. Thank you once again, Christine, for this amazing webinar, and I'm going to encourage people to use that link to get the savings, and we'll send out a replay with the email tomorrow.
Oh, thank you so much, Peter. It's so lovely to be with your community, and I'm really grateful for you allowing me to share all of this. And I'm really appreciative. So thank you to everyone.
All right, guys, have a great night.
Okay, have a good one. Thanks, Peter. Bye,
Mhm.
everyone.